Welcome everyone to today's program. I'm Akanksha Jayanthi with Becker's Healthcare. The program will begin with a presentation, and we will have a question and answer session following completion of the presentation. You can submit any questions you have throughout the presentation by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. Our presenters will attempt to answer as many questions as they can during this time. You will receive an email within about a week following the webinar that will include instructions for how you can download a copy of the presentation. You will also receive a follow-up email shortly after completion of the program. You can submit your feedback or any additional questions at that time. This email will not include the presentation. It is now my pleasure to introduce today's presenters. Sheila Loy is the Director of Healthcare Solutions and Strategies for HID Global. Her primary focus is in identity and access management, educating on secure, trusted identity platforms for information security and converged physical security. Her responsibilities include addressing the requirements for electronic prescriptions for controlled substances and other two-factor authentication use cases. Sheila has a Bachelor of Arts in Business Administration and 30 years professional experience in sales, leadership, marketing, and management. Joe Sumanen is the technical architect with Nemours Children's Health System. Joe is engaged in responsibilities which range from system design and architecture, new technology research, high-level IS support, and a member of the Nemours Enterprise Innovation Team. Joe was a regional project manager and consultant for 15 years and has a Bachelor of Science degree in business from Indiana University. Sharice Jaslani is an EMR Associate Analyst with Nemours Children's Health System. She has certifications in Epic Ambulatory and Bridges. Her current responsibilities include ambulatory support to physicians and nurses in the clinics, e-prescribing, and being part of a lab work group who support and maintain build relevant to laboratory services. Sharice has a Bachelor of Science degree in Computer and Information Science from University of North Florida. It is now my pleasure to turn the floor over to Sheila to begin today's presentation.
Thank you. Thank you, everyone, for your time and your attention today. Why invest in this application? Why utilize electronic prescriptions for controlled substances, or EPCS? The prescription drug monitoring programs are one big reason. This service or application provides visibility to potential drug fraud. 49 states currently authorize a prescription drug monitoring program, or PDMP. 2 states require checking the PDMP prior to writing any new prescriptions, but more are following suit. Keep your eye on state legislation. It will be the driver. Today, the national average for state pharmacies enabled for each is about 70%. Some states are as high as 86%. The national average for state providers enabled for EPCS, however, is only 5%. The state of New York is currently the one state that mandates using electronic prescriptions for controlled substances. However, it appears Maine has recently enacted legislation for 2017. Others that are likely to follow suit are Arizona, California, Texas, North Dakota, Tennessee, Florida, and Virginia. Investigations into drug diversions can be easily accomplished when the data is digital. If you are still using the old triplicate paper on the watermarked pad, it gets filed in a drawer, and you know the pain to launching an investigation by digging up old files. Compliance is the result of mandates, guidance, requirements, or regulations. Everything from that federal government rolls downhill. It is in our estimation that this will not be an option within 5 years' time. Anyone who communicates with the FDA already has to use some special encrypted digital certificates. And I imagine claims data, personal health data, information to CMS might just be next. So understand what EPCS is all about and how it is very similar to other secure identity applications. There are provider challenges with paper prescriptions, and I think first and foremost, it might be the user experience. The user experience for both the patient and the prescriber is a challenge. I'll share a personal story of my own. It's a short story. So last January, I was diagnosed with pneumonia. My physician said he'd write a prescription for cough medicine with codeine so I could sleep. He left the clinic room, roamed around a shared workstation searching for that special pad of paper. He was gone for several minutes and came back looking frustrated. He wrote and handed me the prescription. Now I have pneumonia and feeling like death. I live in Wisconsin, so it was probably 20 below, and I was coughing like someone who has the plague. But I had to proceed to the local pharmacy where I literally sat and waited for 55 minutes. It was a very negative experience. Think of the patients or families, not to mention the providers or admins, who have to go through this ordeal once a month for some type of recurring narcotic medicine, such as Ritalin. It's just not a good experience on either side. And lastly, let's address the ever-growing telemedicine initiative in healthcare. Providers are trying to extend their reach in a convenient fashion via teleconferencing. Put simply, you cannot hand a prescription on a piece of paper through the internet. So consider the enhanced patient experience with online prescribing of Schedule 2 through 5 narcotics. So let's talk a little bit about the actual requirements of a DEA-compliant electronic prescriptions for controlled substance solution. The interim final ruling states that in order to be compliant, you must have a NIST ST 800-63-2 compliant identity proofing at the level of Assurance 3, or LOA 3, with secure credential binding. You also need a FIPS 140-2 validated and certified credential. Providers must present 2 factors of authentication within a certified EPCS module of an EMR platform. The authentication method must be separate from the device in which you are writing the prescription. The first 2 points are the most important, and these 2 points are the 2 that are most often missed in solutions that are on the market today. So be intentional about hitting all the requirements in order not to get dinged by that DEA auditor. With the challenges and requirements covered, I would now like to hand it over to Joe Cinnamon of Nemours Children's Health, who will share their experience. Joe?
All right. Thank you, Sheila. Thank you very much. So first, I'd like to obviously thank everyone for taking the time to join us today as we share our story and our experience with HID and our EPCS solution. Like I said, my name is Joe Cinnamon. I'm a technical architect within information systems here at Nemours, and I've been here almost 6 years. I'll give you just a brief little background about Nemours. Nemours was founded by Alfred I. DuPont back in 1936, and we opened our first pediatric orthopedic hospital in 1940. Today, Nemours is a physician-led pediatric health system with multiple hospitals, specialty care, primary care clinics, research and education, and we're located throughout the Delaware Valley and also in Florida. A few fun facts about Nemours, or things we're really proud of, is that Nemours Children's Hospital received the Press Ganey 2015 Guardians of Excellence Award, and what that really is it's performing in the 95th percentile or above for patient experience from families who had an overnight stay. We're also named among the most wired hospitals and health systems in the annual Hospitals and Health Networks magazine. Also, Nemours Center for Children's Health and Media, which is the creator of kidshealth.org, and that is the #1 most visited website devoted to children's health in the world, which is great. And lastly, there are probably somewhere over 5,400 hospitals in the U.S., and only about just over 4% of those, or somewhere around about 225, have the HIMSS Stage 7 certification, which is great, and Nemours, both of our facilities have that, and we're extremely proud of that. So enough about us. Why did we need, or why were we looking for an EPCS solution? So almost 2 years ago, I was asked to start investigating different technologies and partners for EPCS. And at that time, we were just getting started to expand and grow our telemedicine program. And plus, our Chief Medical Director, Dr. David West, was inquiring with NIS about how we could implement this technology at Nemours and provide an innovative service, right, to our patients and their families, and plus to our providers and our staff. And so, like I said, telemedicine, the initiative was really taking off and expanding at the time. And as that telehealth landscape, was continuing to change, we saw this to be one of the key components to its success, right? It's providing families another time-saving service when their child, is receiving care at Nemours. And I think with an additional service that we're able to offer those patients during a telehealth session, it's the fact that that patient will have a better overall, healthcare experience. So, besides telemedicine, we had noticed several states that were about to require two-factor authentication for EPCS. I think Sheila mentioned there were multiple states preparing for it. I believe New York, and I think she mentioned Maine as well, are getting ready to require it. So we didn't want to be in a position where we were rushing to implement a solution, right? And lastly, we saw an opportunity to improve the quality of care for our patients and our families, and that's huge. So I engaged HID, as they were already providing our card technology and a few other services, across the enterprise. And I asked, how could they help us reach the goals laid out by our leadership, right? And after a few high-level and detailed conversations, and actually I'll mention, which included several with Julian Lovelock. And if you don't know Julian, I highly recommend you read up on him. He's just a brilliant mind and a true innovator, and was a true asset during those conversations. That's Julian Lovelock with HID. So anyway, after several initial conversations, it was really shaping up that this EPCS solution that HID presented was an opportunity to, leverage an existing partner, right, who had the expertise and frankly had the subject matter experts, right, plus the patience and mindset to work in the ever-changing landscape of healthcare. So let's talk about some of the elements that were important to Nemours to have a successful implementation, and a successful EPCS program, right? So the big one was our ease of use by our providers, right? Most important, one of the most important. We wanted to have the same process for EPCS for every provider, right? So it didn't matter where they were. They could be at the office, they could be remotely connecting via Citrix or remotely connecting via VPN. It's the same process each time, which is important for our IS support model as well, right? If a provider had an issue, our service desk could follow the same workflow instructions that to resolve those issues or answer any questions. So that was really important. Also, another element would be having our compliance, our legal team, plus outside counsel work with HID to review and validate that the product and every step in the EPCS process was DEA compliant. I know several folks internally were actually extremely impressed with the knowledge and guidance that HID provided in regards to what needed to be done and how things needed to take place to be truly DEA compliant. And for us, I'm going to mention Darwin Riviera of HID. And Darwin was there from the beginning to the end to really help facilitate those conversations, right? And he provided extreme depth and knowledge, kind of in all aspects of the project. So Darwin was really, again, a true asset. So another element to mention here was important is having that redundant infrastructure, right, or failover topology in place. And I know, most systems you purchase, they have some form of failover infrastructure, right? But it was extremely important for Nemours that this solution have a reliable failover process and topology. And I'm going to go into that in more detail as far as that topology a little bit later on. So we had ease of use by our users, confidence in implementing a DEA compliant solution, a redundant, reliable failover infrastructure, and the last major element, that was really important was just to have a partner we could trust, right? To work with during the design, the architecture, the testing, or the pilot group phase, the go live, and now the support or the day-to-day operations, right? And I can actually truly tell you that HID came through and was able to provide, well, actually, and continues to provide that service to Nemours. So, all right, so let's start to talk about the solution and what it looks like today, right? So I'm going to first talk about some of the components. And one of the first things is going to be what type of card we chose and why, right? We selected an OTP, and OTP is one-time password. So an OTP PKI display card. And the reason for selecting that OTP card was to standardize on a single workflow when issuing controlled substances, right? So I mentioned this earlier during one of the other key elements when selecting a solution, but with hundreds of providers, it allowed us to streamline and utilize the same process for every single provider, no matter where they were. Again, that was very important. So with the other components, we chose an on-premise topology where everything, for the most part, is located within our Nemours data centers, right, versus locating the different components in a cloud environment or offsite. So a brief explanation of those components. Let's start with the Identrust CA, right, and that's their identity proofing process, right? This is an online portal, okay, where a provider registers and starts their identity proofing process, right? And this is a required step to maintain our DEA compliance with EPCS, right? Next, we have our CMS servers, right? And CMS stands for Credential Management System. And CMS is what basically allows us to sign or write the provider's unique certificate, which they got or received from the Identrust CA, to the PKI chip located on their soon-to-be assigned HID OTP display card. And we're going to go through that process on the next slide when we get there. The next component is actually the Active ID authentication server. And the authentication server allows us to finish the pairing process and register the one-time password device, this is the card, with the provider, right? Then we synchronize the card and we test the card and the OTP with the authentication server, and really we validate that everything is functioning correctly. And then the last component, right, I know we've got a lot of pieces here, is the HSM, or the hardware security model. And this is the appliance for key management, right? If everyone's familiar with public and private keys for encryption, this is where we store all of the keys, right? It's the keys to the kingdom, so to speak. So earlier I had mentioned high availability, right, or failover topology. That was an important element when selecting an EPS solution, right? We have multiple CMS servers. We have multiple Active ID authentication servers and multiple HSMs, right? Those redundant devices are physically located in different data centers, but they sit behind load balancers. So logically, users are all pointing to the same IP address or server URL, but on the back end, they're being distributed to the most available server, right? And so basically, if there are any updates to the operating system or application, we can really mitigate any potential impact or downtime to our end users. So if we could move to the next slide, let's go through the actual EPCS credential provisioning process, right? Here's the magic. So there are two processes that run in parallel during the provisioning process, but they both start with the provider there on the left, right? So step one, a provider would like to enroll in the EPCS program. So a provider logs into our internal ticketing system, which is ServiceNow, and they submit a ticket that indicates that they would like to enroll. That generates a ticket to request access within our EMR, which is Epic, and it also sends them 2 job aids on the enrollment process. And I'm going to go back to the Epic access request in a minute. So the provider is now following our step-by-step job aid and logs into the Identrust website. This is the portal, right? They complete the online registration and start the identity vetting process. And this is where the DEA required the 3rd level of assurance to be performed for identity proofing, right? If that's successful, an activation letter is then mailed to the provider. And it takes 1 or 2 days, and they receive the letter, and then they go to their local issuance station, which for us, we've located those at each hospital and also at some of our larger clinics. You know, actually for our remote sites, we like to hold enrollment sessions. So we have everyone register on the portal. And then once they have all their letters in hand, right, everyone's got one, we schedule a day to be on site, right, to walk everyone through the issuance process and also allow them to ask any questions in a general forum. And we found this to actually be the most efficient use of everyone's time. So that was a great lesson learned there. Now, I haven't been part of too many projects where it's a truly the win-win outcome, but this EPCS solution, it significantly benefits our patients and their families, and our providers and their staff, right? So from the patient perspective, it reduces travel time. It really simplifies the process in receiving medication and services. So instead of taking time off work, driving to the clinic or the hospital, picking up the prescription, and then finally making the long, they're just swinging by the pharmacy like they would for any other prescription, but it's on their schedule, right? Which is great. Now, on the flip side, for a healthcare system, our providers and our staff love the efficiency, and the time that it saves them each week. I know several stories. I spoke to one office where it saves them anywhere between 4 to 8 hours per week, not having to print, sign, mail, resend, verify with the family, and on, right? So, I mean, that's the most rewarding part. It's that you're actually making a difference in someone's day-to-day workload, right? You're making their life easier, which is wonderful. So even though this solution is a somewhat complex or sophisticated back end and workflow, it has a very simple process on the front end, right? Which is exactly what you want for an end user experience. So now the provider's been issued their card, right? And we're going to go back and talk about the logical access request within Epic, but I'm thinking now I'd like to do a polling question. So before I turn it over to Charisse to discuss the EMR enrollment, just be curious to know which EMR or EHR platform everyone is using, right? So if you could use your polling function and the options listed, if you select other, then you can open up the chat window and you could type in the name of that system there. So if everyone would take a second to answer that poll, that would be great. And while you guys are doing that, I'm going to go ahead and let one of my coworkers, Charisse Jeswani, take it from here. And go ahead, Charisse.
Thanks, Joe. So with regard to logical access control in Epic, the department or provider can request EPCS access in our Epic EMR by calling our help desk or submitting a request through our ServiceNow help desk system. At that point, a ticket is routed to our Epic ambulatory team. And by this time, the provider usually already has e-prescribing privileges in Epic, so it's now just a matter of granting them EPCS access in their provider record and making sure that they have a DEA number stored in their record. Once their provider record is updated, our medical director, Dr. David West, receives a message in Epic with the EPCS grant access pending his approval. Dr. West is currently our only EPCS administrator in Epic and DEA registrant with a hard token, and he verifies the provider in our credentialing system to determine whether to approve or reject the request. And if it is approved, the provider is notified, and then they can begin e-prescribing controlled substances using their two-factor smart card. And next slide, please. So what did it take for Nemours to successfully deploy a DEA-compliant EPCS solution? So this diagram identifies our key stakeholders from beginning to end. As Joe mentioned, a few years ago, he had a conversation with our CIO and our medical director, Dr. West, to explore a DEA-compliant solution that would be best suited for our organization. We had to make sure that the technology and processes guards our patients' information, and most importantly, that it's going to be a solution that's going to continue to give the very best care for the patients that we serve. So as we reviewed our solution requirements, HID happened to have a DEA compliant solution, and since we already partnered with them for access control, it made sense to go with HID. One thing I'd like to point out is the importance of having a project manager to help facilitate this implementation process, and that way that person makes sure that we were meeting our deliverables and our milestones. For workflow definitions, a lot of time was spent in this phase of the project. The previous slide outlined the HID credential provisioning process and logical access control in EPIC. And if it's one lesson I learned is to make sure you understand your current onboarding process for your providers. We had many meetings with HID, with legal and outside counsel to make sure the workflow for proofing, two-factor authentication, and logical access control was outlined clearly, and that each process was in compliance with the DEA. So our proof of concept team consisted of our technical architect, Joe Sumanen, technical operations manager, information systems, SureScripts, our e-prescribing vendor, and we also had a dedicated HID solutions architect, who is Darwin Rivera, that Joe mentioned earlier. And he was tremendous in helping us with HID's EPIC authentication plugin and the configuration of Active ID appliance and the credential management system. We also had a dedicated subject matter expert from EPIC, Luke Matthews, who was also tremendous with not only the EPIC controlled substance build in our EMR, but he also worked with HID to ensure that the functionality between EPIC and HID's plugin was working. And lastly, we have Dr. David West, who is our physician champion of the project. And apart from being our medical director and liaison for our providers, Dr. West is extremely technical, and he understands the build and workflow for our organization on our EPIC EMR. So he was tremendous as well. So discussions for proof of concept began third quarter of 2014. We had generic providers created in our EPIC test environment, and the objective was to be able to demonstrate e-prescribing a controlled substance order in EPIC, digitally sign the order, launch HID's two-factor authentication plugin, and this is where the provider is prompted to enter their one-time password using their Active ID smart card, and then they enter their personal PIN. Once authenticated, the electronic order is sent to our SureScripts staging portal. And I can tell you that by mid-December, just a few months after we just started discussion of proof of concept, we had a working prototype where we were able to e-prescribe a controlled substance test order to our SureScripts staging portal. So as you can see, things started to move quickly after that. Joe and our technical operations manager worked with purchasing and legal and HID to begin purchasing equipment and items required to support our infrastructure. And HID professional services stepped in from that moment forward for workflow and requirements review. They came to our organization for use case discussions. They designed a test plan for our production planning phase. They trained our organization on Active ID appliance, the credential management system, the EPIC plugin, and they made sure that we had the proper documentation to support it. So our initial production rollout was December 2015, and it was to a group of 7 pilot providers from psychiatry. We had 5 at our hospital at Alfred I. DuPont in Delaware, and then we had 2 at our Jacksonville clinic here in Florida. The objective was for each of the providers from our pilot group to e-prescribe at least 10 controlled substances in a month, and if they were, we considered that a success, and we would move forward making the EPCS solution available across the enterprise. So one of our providers actually e-prescribed 70 controlled meds successfully the first 2 weeks. He went live December 22 of 2015. So by the end of this past January, we made the EPCS solution available across the enterprise. One thing I'd like to mention is other key stakeholders in this project. We have a learning services department who created our job aids, providing instructions on how to request EPCS, and another job aid on how to actually do the e-prescribing of the controlled substances from within our EPIC EMR. We also had our application engineering team who helped design the ServiceNow tickets for the EPCS process. And then we have our service desk and command center who are trained to be operators of Active ID Management Console and needed to have a thorough understanding of EPCS and to be able to field questions from our providers. So use case discussions here on the project. So as I mentioned, HID Professional Services came in for workflow and requirements review, and which is basically a 2-day workshop to gather requirements for our EPCS solution. So they helped us document processes and provided instructions for our providers so that our providers know how to register for an EPCS compliant credential from Identrust. So they know what they need to do when they're up for a certificate renewal, and they knew what to do whenever they have a bad card and it needed to be replaced. HID also provided instructions for our operators, so they understood their roles and responsibilities in providing support of the Active ID Management Console and also providing support to our providers. So we've touched on proof of concept, documentation, talked about our pilot test group, feedback cycles. So obviously, since we made the EPCS solution available, the benefits of having it was saving time, obviously, for our providers, as Joe mentioned, having to write prescriptions and mail them out, which also saves our patients a lot of time. Other items we've encountered since going live is our providers forget their PIN and need it reset, or their one-time password credential on their smart cards out of sync and needs to be resynced. And then we have a few providers that know EPCS available but aren't familiar with the process. So it's a matter of educating our providers so they have they know the instructions to request EPCS. And then other times we have providers, they've got the card in hand, but they don't have the access set up yet in the EPIC EMR. 6 weeks after we went live this past January, we captured 15% of ambulatory controlled substance prescriptions with e-prescribing across the enterprise. And as of today, we are at 50%. So this is exciting times for our organization, and we're looking forward to seeing what happens in the next 6 months. And I will take it back to Joe.
Thank you, Sharice. Evaluating security and privacy, and really, starting to leverage the technology we've invested in, right? So towards the end of our pilot group phases, we started to test and implement our two-factor authentication for remote users. So this is anyone connecting to the network via our Cisco VPN solution or our Citrix Connect 2 portal. Phase one was really preparing our service desk, right, with training and work instructions on how to handle, let's say, the top 5 types of calls, right? And then communicating to the enterprise that this was coming, right? Enrollment deadlines were set and enforced, which is important. And then we just began this massive enrollment process, right? Users, they'd follow their how to enroll job aid, which again were these step-by-step instructions, and they'd let them know you need to go to this internal self-service portal. They'd log into the portal with their current network domain credentials, and then they'd simply just click on a link to enroll their mobile device, right? At that point, they would say, okay, I've got to download the HID iPhone or Android or whatever mobile platform they have, the app, and then enter in a few registration codes on the portal end and on their mobile device. This is really to synchronize the tokens between the technologies. They would test the connection, and then they were set up and ready to go. So the next time they tried to connect remotely, it would prompt them to connect via two-factor authentication. Now, we did have a grace period, right, where if you had an issue, you could still connect via your normal username and password, but that was only for a limited time, right? Well, since the rollout, I might see 1 or 2 service tickets a month now, which I think that's pretty great considering we have about 6,000 active users. So I'm extremely satisfied with that. The next application of the technology that we're currently working on is it's going to be added an additional layer of security for individuals with elevated domain accounts, right? So that's your system administrators, your enterprise admins, and this is going to add that additional layer to those powerful accounts, right? In order to mitigate any potential threat, or for some reason if those credentials were to become compromised, right? So I also want to touch base on some of our lessons learned, right, and some of our keys to success. So with my experience in this project, one of the most important keys to success was bringing our support staff or service desk in early in the planning stages of the project, right? Several reasons for this. One being this was a new system. We really needed everyone to understand the workflow and how things worked, and and actually how we were going to handle the support expectation and what we would ask from our frontline support personnel, right? Now, ideally, from a support model, you want to strive to resolve any issue on the first contact, right? So, what tools could we provide our help desk to handle, most of those issues, right? One thing we did was exposing and training the service desk supervisors, right? They're going to be there in the room with them and hopefully be able to assist in the resolutions, and it's also going to allow them to train any new staff, right, who didn't take part in the initial onboarding or support staff training. So it was also important to ensure that they understood the resolution process of any issue, right? Even if they knew they wouldn't be able to take them all the way through the process, from a customer service perspective, right, to be able to set the expectation of what needed to be completed in order to restore service again is very important. So, and, another key, and actually Sharice mentioned this too, but is having a strong internal project manager to help guide the project. So I know people say it all the time, but we have an excellent PMO here at Nemours, and we are extremely lucky to have a wonderful project manager to keep the project moving along, and also be that single point of contact for HID's professional services team that we were working with during the project. So one of the last keys I'll mention here is proper advertising or education, right, to the providers. So we started with this small pilot group, right, but it quickly became evident by word of mouth that other providers were eager to volunteer for the pilot. I believe the primary driver for that was it was actually saving them time, right, on their paperwork and allowing them to more time to do what they're supposed to be doing, right, and that's seeing and caring for patients. So really, it's how are you going to get the word out, and how are you going to let folks know that this new service is available, right? And I know Sharice just mentioned it, but I really thought, again, after 6 weeks, we went from 0 to 15% of all of our controlled substances being written electronically. Now, after 7-8 months, we're all the way up to 50%. And I mean, to say the least, it's very exciting to watch that grow. So I'm going to go ahead and pass it back to Sheila to close out with some few thoughts, and then allow time for our Q&A. So Sheila.
Thank you, Joe. And Sharice, thank you for sharing your story with everybody who has taken the time to join us today. There is no more powerful statement than the one simply stated here by the physician champion, Dr. David West, head of Nemours Informatics. Using our HID solution for electronic prescriptions for controlled substances saves our doctors time, plus creates a positive experience for our families and patients. So that hit the primary objective, and it was a rare win-win. So it was eloquently stated here, and I think it's a great summary. The benefits for EPCS beyond DEA compliance are manyfold, but I hope you have heard that the patient or patient family experience tops that list, followed by a very, very close second in that the provider's experience is also enhanced. The security added by issuing narcotics online also provides digital audit trail for easier investigations or internal reporting. We learned how easily it is to leverage the investment for one use case and roll out complementary two-factor security, which reduces HIPAA risk and reduces the risk of any medical identity theft or cyber breach to the infrastructure. Lastly, and very importantly, as Joe mentioned, it was easy to support, easy to train, and easily adopted. Simple is success. Most of you probably carry an HID card as your ID badge today. So whether you knew it or not, HID has been managing identities around your facility for years. HID Global has identity management and authentication software expertise, tokens, fobs, credentials, biometrics, readers for the door, and desktop. We can help you securely manage identities for independent or converged identity platforms. We are a global brand with substantial R&D, financial resources, and an innovative posture. HID has a channel model for go-to-market, but our interaction foundation with dealers, distributors, manufacturers, or end-user customers starts with building a relationship. So if you have any interest in learning more, please do not hesitate to contact us. And with that, I thank you again for your time and attention, and we'll turn it back to the moderator for some questions.
I want to thank our presenters for their excellent presentation and for all of you for participating today. All right, and now starts our Q&A portion of the program. And as a reminder, you can submit any questions you have by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. Our presenters will attempt to answer as many questions as they can during the time we have for Q&A. All right, and one question for our presenters. What are the two factors you use at the time of signing controlled substances?
This is Joe, sorry. We have our OTP smart card, so you saw that. What it is they'll take their card, they'll press the OTP credential, right? It'll present that one-time password. So they're adding that one-time password with their network credentials, and those are the two factors that are utilized. So it's the OTP and the network credentials.
And a PIN.
And the PIN, sorry, yep.
Yeah.
Right.
Yes.
Sorry.
Yes,
yes,
one, two.
PIN.
Yeah. Mm-hmm. Good question. That's a really good question.
Wonderful. Thank you so much. All right, and that's going to conclude our Q&A session today. And again, I want to thank our presenters for their presentation and for everyone for participating. We look forward to having you join us for future webinars. This concludes today's program. Have a wonderful afternoon.